My name is Tanya, and I consent to being recorded.
Knock, knock, knock.
Come in.
Hi, my name is Antionette, and I'm your nurse today.
Hi, Antionette.
May I have your name and date of birth?
Yeah, my name's Tanya Torres, and my birthday is 1/24/92.
All right, go ahead and check your armband. Do you have any allergies?
No.
Are you currently in any pain?
No.
Okay, so you say your pain level is 0?
Yep. Okay.
Okay, wonderful. So what we're gonna do is a head-to-toe assessment on you today. Is
Okay.
that okay?
Yeah.
Okay. So first, of course, you can talk. Airways clear. You're breathing fine. Not using any accessory muscles. Let's start with taking your vitals.
Okay.
All right. So I'm gonna go ahead and we're gonna take your blood pressure, heart rate, temperature, pulse oximetry. So easy stuff first. I'm gonna put this on whichever finger is best. It's helpful if we turn it on. And then we'll then take the temperature. Alright, your temperature is 98.1, which is good. And oxygen saturation is 99, and your pulse is 91 on here. Next, I'm going to do your blood pressure. I'm going to grab my blood pressure cuff quickly. And before I do that, I want to go ahead and clean my stethoscope
Okay.
with this alcohol pad, just to make sure it's nice and clean, and also it's going to be warm for the patient. We're going to go ahead and take her blood pressure.
Okay.
Alright. I got 110/78. Does that sound about what
Yeah.
I'm saying?
Mhm.
Okay. So that is within normal limits. Of course, we want it to be 120/80 or lower.
Okay.
Okay, so we've done that. I'm just gonna place this over here. Alright, so next I wanna go ahead and start my assessment by looking at your scalp. So by looking at your scalp and feeling it, symmetrical, no bumps, no lumps, no lesions. Also, do you know what day it is?
Yeah, it's Monday.
Do you know where we are?
It's at Valencia Clinic.
And do you know who the president is?
Trump.
Okay, so level of consciousness, you know.
Mm-hmm.
All right, so of course your head was symmetrical. There's no bumps, no lumps, no lesions. Your face is symmetrical. No drooping of the eyelids. Your face is symmetrical. Let's go ahead and we did that. Let's go ahead and take a look at your ears. I'm going to use
Okay.
my pen light. Okay, I'm going to look at each one of your ears. There is no drainage, no redness, no blockages. No drainage, no redness, no blockages. I'm gonna go ahead and feel your ears and tell me if you feel any pain.
Okay.
Do you feel any pain when I do that?
No.
Okay. So while I'm at your ears, I'm just gonna go ahead and test your cranial nerve 8.
Okay.
All right. So I'm gonna go ahead and I'm gonna stand behind you.
Okay.
Because that would be easier for us to do this. All right, and I'm going to occlude this ear.
Okay.
And I want you to tell me what you hear.
Okay.
Okay. Nursing.
Nursing.
All right, same with the next ear.
Hard.
Okay, so you can hear. Also, do you have any allergies?
No.
Okay. Okay, so
No,
allergies.
no medicine, no food, nothing.
Oh, good.
Mhm.
All right, so we're done with your ears. Now let's go down to your eyes. Do you wear glasses?
I have contacts.
Oh, okay, good.
Yeah.
So usually that's cranial nerve 2. Of course, you would check that with your optometrist or like a Snelling chart.
Okay.
All right, so I'm going to look and see. I'm going to look at your pupils.
Okay.
See if they're equal and round. So I'm going to shine a light in each eye and see if you have a reflex. Yes, you do. And I want you to go ahead and I'm going to check the accommodations. I just want you to stare at this pen. All right, accommodation good. That was also cranial nerve 2, I believe. Next, I'm going to check 3, 4, and 6, which is like the ocular motor nerve, just to see if your eyes can do what they need to be doing.
Okay.
So I'm going to have you follow my pen light.
Mhm.
And don't move your head, just follow the pen. All right, wonderful. All right, since I'm on your face, I want to go ahead and look at your nose. All right, I don't see any polyps, any drainage, any bleeding. Do you have any problem with bleeding or anything like that?
Mm-mm.
Okay. If you can put one finger over your nose, breathe in. Other finger over your nose, breathe in. Do you have a problem with your breathing or anything like that?
Mm-mm.
Okay. I'm gonna go ahead and I'm gonna see if you can smell.
Okay.
Your sense of smell is good.
Okay.
And tell me if you can smell what this
Oof.
is.
Very strong.
Okay, that's alcohol.
Yeah.
All right. So I'm also gonna take a look back to your eyes. To see your sclera is white. I'm gonna touch your face and pull your eyes down. Conjunctiva is pink. Iris is. They're both the same color.
Yeah. Uh-huh.
Cornea is shiny
Mhm.
and smooth.
Mhm.
All right, and we did the nose. All right. So can you go ahead and?
Sorry, I'm a little itchy.
It's okay. Go ahead and raise your eyebrows for me. Can you smile? Can you frown? Puff your cheeks. Stick your tongue out. Wave it back and forth. Let's see. Okay, I was testing your cranial nerves to see if you had those. I'm gonna look into your mouth. Do you have any problems swallowing pills? Any problems like gag reflex, anything?
No.
Okay. All right. Open your mouth for me. All right. It's pink. No teeth. Well, your teeth are there, but there's no broken teeth.
I was like, oh no. No.
Your uvula is midline, and I cannot see your tonsils, which means that you are not sick.
Mhm.
All right. I'm gonna go ahead and feel for your sinuses.
Okay.
All right. You tell me if you feel any pain.
No.
All right. So while I'm on your face, I'm gonna go ahead and feel to see if I can palpate your lymph nodes. Okay.
Mhm.
All right. So this is preauricular. This is postauricular. Occipital. Submandibular. Submental. Jugular. It's a cervical chain. Also, I want to feel for your thyroid. Swallow for me. Great. And while I'm here, if you can open your mouth and close it. All right, I don't feel any clicks. Do you have any pain there?
No.
Okay,
No.
wonderful. Also, looking at your neck, I don't see anything poking out. I'm here. So I'm gonna feel your carotid one at a time. And we do that so that we don't occlude the artery, stop blood flow, and you pass out. That would be bad.
Okay.
All right. They're both 2+. They're not bounding at all, so that's always a good thing. I'm gonna listen for what's called a buoy. Okay, that's just to make sure there's no occlusion.
Okay.
I'm gonna listen to it with the bell of my stethoscope.
Okay.
All right, and once again, we listen on each side. All right, wonderful. I don't hear any swishing sounds, which is good. All right, and of course, since I'm here looking at your neck, I want you to go ahead and shrug your shoulders for me. All right, so that I'm checking for your accessory cranial nerve to make sure that you can do that.
Okay.
Next, I want to go ahead and auscultate your heart and your lungs.
Okay.
All right, so first we're going to start with the heart. Okay, turn it back to the diaphragm. I'm going to start with the aortic, which is in the second intercostal space. And then to the pulmonic, which is also down on the left side on the second intercostal space. The aortic was on the right. Then we go third intercostal space to Erb's point. If I could ask you just to lift your shirt up, we're gonna go to the tricuspid area. Okay, and next we're gonna go to mitral, which is the fifth intercostal space, midclavicular. I'm gonna listen here for a full minute, okay?
Mm-hmm.
I got 89.
Okay.
Does that sound about right?
Mhm.
Where your heart rate is? Okay. So we've done that, and next I'm gonna listen to your lungs.
Mm-hmm.
Since I have my stethoscope out, might as well continue to use it. All right. So I'm gonna go in 4 lung fills just to listen to make sure they're clear. Just breathe in and out normally every time you feel my stethoscope move. Okay, I'm gonna go under your shirt. Okay, I'm gonna listen on the axillary side. All right, and on the other side. All right, and I'm gonna listen to the back.
Okay.
All right, and pretty much the same thing. Okay, back looks symmetrical. Your spine looks midline. It doesn't look like it's curved. There's no hunching of the back. All right, so I'm gonna start. I'm gonna go under your shirt a little bit, okay?
Yay.
All right, so you might feel. I'm just gonna go under your shirt.
Yeah.
All right. Lung sounds, they're clear. I was able to hear the bronchial, vesicular, and vesicular lung sounds. There's no adventitious lung sounds,
Okay.
Which means that you're breathing fine. Everything's great. Also, when I listened to your heart, if there was an issue with me hearing any heart sounds, I would lay you left laterally just to listen for a little bit longer.
Okay.
All right. Since I'm back here, all right, I'm just going to move your hair one more time. No, you're fine. Every time I move my hands, I want you to say 99.
Okay. 99. 99. 99.
Okay, wonderful. All right, we're good there. All right, and all right, I'm gonna come back here one more time because I'm going to percuss the back for your kidneys just to make sure there's no tenderness or anything of that nature.
Okay.
All right. You feel any pain?
Mm-mm.
Okay, great. All right, so we're back in the front. We did that. Your skin is actually, you have a tan. Did you go out this weekend?
No.
Your skin is warm. It's normal for ethnicity. All right, I'm gonna go ahead and assess your radial pulse for 1 minute as well. A minute seems so long. I got 91.
Okay.
Also, I'm just gonna do the other one for a full minute as well. All right. I actually was assessing your respirations as well.
Okay.
You were at a 17.
Okay.
All right. Your pulses were both symmetrical.
Okay.
And they were 2+.
Oh, nice.
Strong and bounding. I'm also gonna assess your brachial pulses here. The same, 2+, strong and bounding. All right, and your hands. Turn them over for me. Okay. Hands are warm. All right, I'm gonna do capillary refill. Oh my gosh, you injured yourself.
Yeah, it's just a little cut.
All right, so less than 3 seconds. This means also good circulation as well. Your skin means you're not dehydrated, meaning it doesn't stay up, no tinting going on. That is always great.
What's that called?
This is called skin turd.
Oh, okay.
So this is basically just to see if you're hydrated.
Oh,
So of course
okay.
your nose wasn't dry, mouth wasn't dry, you're good. You're getting enough water and you're
Yeah.
you're dying, so that's great.
Mhm.
So next thing I want you to do, if you can stand up for me.
Okay.
All right, I want you to stand with your hands at your sides.
Okay.
And I want you to close your eyes. All right, great. And I want you to, if you can, walk to the drawer and walk back. Wonderful.
Mhm.
Okay. If you can take a seat on the bed and actually lay down, I'm going to go ahead and assess your abdomen.
Okay.
All right. So you have good gait. You can walk.
Mhm.
So that's important. All right. So we're going to start with your abdomen. But first, I want you to go ahead and, where's my finger? Push against my hands. Pull against my hands. You have strong bilateral muscle strength. Can you raise your arms?
Yeah.
Wonderful. Wave them side to side. I'm joking. No, you're doing well. You're doing well. You're doing well. All right. And raise your shoulders for me. All right. Good. Everything looks symmetrical. You have strong bilateral muscle strength in your upper body. Next, I'm going to assess your abdomen. First, I want to go ahead and I'm going to listen. I'm going to start in the right lower quadrant.
You just need to look at it.
I'm going to look at it. It's actually flat. I need to lose some weight.
Okay.
You look great. It's flat. I don't see any lesions, any scars, or anything of that nature. I'm going to listen right lower quadrant going clockwise. Okay?
Oh, okay. Okay.
All right. All right. I'm hearing sounds. All right. So normal active bowel sounds. I'm just going to go ahead and listen for a breathe here. And no swishing, so that's great. All right, so next, after I auscultate, I'm gonna go ahead and I'm going to percuss your abdomen, just listening for tympani, no dullness areas, which is like normal. All right, so I'm gonna put my hand here. Sorry, my hands are a little cold.
You're good.
All right, just in the same 4 quadrants. All right, so next I'm gonna palpate your abdomen. There was no dullness, so no masses, things of that nature. I'm gonna palpate 1 to 3 centimeters, just to see, make sure there's no masses, no pain, things of that nature. Are you in any pain?
Mm-mm.
Have you had any issues using the bathroom?
No.
When was your last bowel movement?
Today.
Today? Was it normal,
Yeah. I think it's normal.
solid?
Mhm.
All right, great.
Brown. Yeah.
Good color.
Mhm.
Mine's a blue because I've been drinking chlorophyll.
Oh no.
But there's no masses. If there were, we would do a deeper palpation in between 5 to 8.
What if you didn't hear anything?
If I didn't hear anything, then I would have to listen a little longer, say 5 to 8 minutes.
Oh, okay. Okay. Well, that's good.
Say 5 to 8 minutes. If you want, you definitely put your shirt back down.
Okay.
All right. So next, all right, I am going to put on some gloves because I want to go ahead and look at your legs, test your strength in your legs,
Yep.
so
Okay.
forth. All right, so gloves on. This is important. You just can't be touching people without gloves sometimes.
Yeah.
In certain areas of the body.
Okay.
Let's see. Wait. Duh. I need to feel your popliteal.
Oh yeah, yeah, yeah. That's
First.
That's the knee pulse, right?
Yeah. These are the pulses behind the knee.
Okay.
And I want to feel if they are, of course, equal and symmetric bilaterally,
Okay.
all that good stuff. So I'm going to put my gloves in my pocket quickly. I'll get some more. I just want to feel here. Okay. There they are. Strong, equal bilateral, 2+ symmetric, bounding. While I'm here, I want to feel your legs. Make sure there's no swelling, no edema. If I left fingerprints, there would mean there may be any water retention, things of that nature.
Mhm.
Let's see. Next, I'm gonna go ahead and I'm gonna feel your posterior tibial.
Okay.
All right, which is basically around your ankle area.
Okay.
All right, so I'm gonna get right about here. down just a little bit before we take them off. Don't want to fondle your feet yet. All right, they are strong, symmetrical, bounding, bilateral, good. All right, so I'm gonna go ahead and put on my gloves, then I'm gonna feel your pedal pulses, and then we'll go ahead and test your muscle strength and all of that. As a matter of fact, since I'm here, I might as well test your muscle strength first, before I start touching you again. Can you pull your knees up? All right, and straighten it back out. All right, so abduction is basically where you spread your legs apart. You can do it one at a time or together. That's great.
Okay.
You have strength in your legs, which is always good. You were able to walk earlier, so that means you're doing good there. All right, I'm gonna go ahead and I'm going to feel your pedal pulses, and then I'm gonna test the muscle strength in your feet as well, okay? All right, and by the way, your skin was soft as well. There were no issues there. All right, let's see. And, all right, I'm gonna feel your pedal pulses. Okay, strong, symmetrical, bounding, bilateral. Why don't you go ahead and toes to nose. All right, feet down. All right, nice pretty color. All right, I'm gonna check for capillary refill on each toe. All right, they come back within 3 seconds. I'm gonna go ahead and put your socks back on because it is rude not to do that. I'm sorry, I don't want to be.
You're okay. I could do it for you.
Wrestling with your toes, because that's rude. All right, so I'm gonna put
Thank you.
put this back on. All right, I'm gonna take off my gloves.
Okay.
And I'm gonna sanitize my hands. All right, I'm gonna make sure the bed is in the lowest position.
Okay.
But before, I just want to check one more thing while I was at your face. I forgot. Let me just grab something. I want to check your cranial nerve 5.
Oh, okay.
All right. So
I'm assuming I close my eyes.
yes, you would
Okay.
close your eyes.
Yeah.
All right. And once you close your eyes, you would tell me where you feel it and what do you feel.
Okay. Ooh, soft. It's on this side, my left side.
Okay. And
Tickles on the right side.
okay, great. That means you can feel it, and we're all good. So I would make sure call bells and reach, bed to the lowest point.
Okay.
I would sanitize my hands, and the doctor will be in with you shortly.
Okay. Thank you.
You're welcome.